Y'all give it up and show your love right now for the one and only with our COVID-19 update, Dr. M.J. Collier. Dr. Collier, good morning.
Good morning, and we're here with your COVID update this morning. We're going to talk about, always starting with the statistics. We are now at 1,005,200 cases documented in the United States and 57,500 deaths. The death rate continues to be 5.7%. Is pretty consistent, and that's where we are with that. A couple of things that have happened in the last 24 hours. One, we talked about Pepcid or famotidine as a treatment, which is a drug that is used for acid reflux. It's a gastrointestinal acid blocker, but it's been shown to stop replication of the virus. Now, that drug costs pennies on the dollar, and it can be administered orally. The new drug that they were talking about from Gilead Pharmacy, that's remdesivir, is an experimental drug that they have found that will shorten the course of the disease. In the study that
yeah, that's what I was about to ask you about. They just got finished talking about that on the news. Yeah.
Mm-hmm. Yeah, it cuts down the course from, say, 15 days to 11 days. Of course, that's not a home run. That's kind of like Tamiflu. It shortens the course. It doesn't cure the disease process. But again, it gives hope that there's a therapy, and most importantly, it does block the virus replication and the activity of the virus. The problem with that is it's an IV drug, so that means they will only be utilized for people that are in the hospital. So they'll have to come up with, places to get IV therapy, in the neighborhood if they want it really to be effectively used. So, or they come up with an oral version. I don't think an oral version is going to be created. So right now it's going to be an IV way of treating the drug process. Guess what, Ricky? Today is the last day of federal guidelines for distancing. So they expire today, and President Trump says that he is not going to extend them. He said if governors want to do whatever they want to do in their individual states, then, they can create their own policies. But the federal guidelines that require social distancing expire today. So that's where we are with that. Yeah, so we're going to have people, again, passively doing more than they should do. They're going to start going out again, particularly since there'll be no immediate negative response. They'll go out and do something today, and tomorrow they'll feel just fine. And so they'll say, okay, I'm testing this theory, but 2 weeks from now, 3 weeks from now, that's when we're going to have some real issues. But Ricky,
right, absolutely. You're going to see a spike go back up because people going to think that this stuff is all over, and that second wave ain't going to be no joke. Man, it'll be the end of the summer next year before things get to normal. That's just my prediction.
I concur, and the thing is that when it comes to second time, it's going to be more devastating because it's going to have a more vulnerable population that is going to attack. So, it's going to, hopefully it will reinstill a little trepidation in people's minds about this because people are becoming passive. And, they're saying, okay, most people now do know somebody that has tested positive, do know somebody that has had to be hospitalized and possibly even died, not just famous people, but people that you know. So that ought to make it real for most people, and I'm hoping that it will. I just want the listeners to the Rickey Smiley Morning Show to remember, still protect yourself if you decide to go out. Make sure you're wearing that mask, but most importantly, make sure you're wearing your eye covering. The eye covering, again, I've had people come to me. They're reaching out to me on social media. They're coming to my office, and they're telling me, I heard what you said on Rickey Smiley. I have my glasses. I'm wearing my glasses, and they are. So I want to see, when I see people out in the community, I don't want to just see you wearing a mask now.
Dr. Collier, if anybody, I'm going to cut you off. We got to go to break. But anybody want to talk to Dr. Collier, you can call right now. 866-9-RICKEY, 866-9-RICKEY, taking your phone calls with the one and only Dr. M.J. Collier. Up next, Rickey Smiley Morning Show.
The Rickey Smiley Morning Show.
Y'all, we got Dr. M.J. Collier giving us our COVID-19 updates like you do every single morning. We want to thank him for taking out time, getting up this early, being with us. You're on with Dr. M.J. Collier. Good morning.
Dr. Collier, I have no immune system. I had ITP, it's a blood disease, and they took my spleen out. So I have no immune system. I just want to know, if you have no immune system, what you do?
You're going to be a great candidate for the vaccine once it's created. Make sure that you get that, and then all of the things that we do to boost your immune system. You do it without a spleen, your immune system is limited, but you still have immunity from your bone marrow. So we want to make sure that you do whatever you can to boost those things. Supplements such as zinc, the vitamin C, the probiotics, vitamin D, all of those things you've heard me talk about will be a standard part of your regimen forever, for every day. You should take those things to boost what immunity you do have. But it's very important, though, that you try to avoid exposure. You need to isolate. You need to make sure that if you have to go out, you're wearing your mask and you're wearing your eye covering.
All right, you're on with Dr. MJ Collier. Good morning.
Okay, so my question is the medicine that they're suggesting for the Pepcid AC, that they're suggesting for the coronavirus, they have a class action lawsuit about that. So are they still really wanting people to go out and purchase this and buy it with this class action lawsuit going on?
The class action lawsuit is against ranitidine, which is Zyrtec, not Pepcid. Pepcid is famotidine. They are both in the same class, but there's no problem with the Pepcid formulation. The other one would be Tagamet. So the two drugs that are what are called H2 blockers, they block H2 receptors in the stomach, and that have no problems are Tagamet and the famotidine or Pepcid.
All right, you're on with Dr. MJ Collier. Good morning.
Yes, good morning. I would like to know why we are predicting that the second wave of the virus will be worse than the first.
Okay, the second wave will be worse than the first because you'll have everybody that has been social isolation and in home quarantine, their immune system will be totally and completely open to infection by the virus. So that patient population will be very, very susceptible to first-time infection. So when that happens and when those people are out and about, every benefit that they have gotten from being socially isolated will be lost, and the virus is still there. The numbers are still going up. They haven't peaked, and so people will be available and susceptible to it. So when that happens, because more people will be out, it will be a more intense and more people will be together. Then you're going to have spreading of the virus. So that's why the numbers will be high.
All right, you're on with Dr. MJ Collier. Good morning.
I'm concerned. I know that they're telling people if you've been around someone that has had the virus to stay quarantined for 14 days. But why are we just saying 14 days when people can, when I know several people who have the virus and they've been in the hospital, out of the hospital, and even when they come out of the hospital after 2 weeks, they still have to quarantine for 14 days. So why are we just telling people 14 days? Because if you have symptoms at day 5 and at day 14 you go out, you're still able to spread the virus.
You're absolutely correct about that. There are outliers that are extending the virus to 21 days, 30 days, etc. But 14 days is the average length of infection, and they're just settled on that number as a reasonable compromise. But there are times when people, if they're still having symptoms, then you start counting day 1 from the day of the last symptom as your next 14 days. So, again, 14 days is not ideal. It's just more realistic.
Okay, you're on with Dr. MJ Collier. Good morning.
I wanted to ask him, if you wear glasses, because you just asked the question to wear the goggles, but if you wear glasses, how are you going to wear the goggles?
Okay, there are goggles that will fit around standard glasses, and so that's what I would recommend because there are too many gaps in your traditional eyeglasses around and on the bottom and on the side. So it's very important that you wear goggle styles. Now you don't have to wear the ones. You're going to have to wear a bigger version, almost kind of like scuba diving goggles. But you need to cover that area, or you put contacts in and then put on the goggles that are close to your face.
All right, hey, Dr. Collier, let everybody know how you can be reached.
Okay, you can reach me on all social media at Ask Dr. MJ, and we're going to bring you some more information tomorrow. We're going to talk about the second shift phenomenon. That's for women. That's going to target the women, the female listeners. Brad and Eden, we're going to talk about that tomorrow, how this is affecting females, the coronavirus. Men are getting the disease, but women are catching the heck for it.
There it is. Dr. MJ Collier, man, thank you so much, man. Gary got to
we appreciate you.